Hi everyone, myself Saranya, Assistant Professor from SNS College of Allied Health Science, Coimbatore. Today we are going to see a very interesting topic, which is Erythrocyte Sedimentation Rate. So before going into a topic, I am going to see about the case study. Here is a patient profile. Her name is Priya Sharma and her age is 62 years, female. What is her complaint is she has a joint pain, stiffness in the shoulder and the hips, and she has a tiredness for almost 6 weeks. On physical examination, she has a stiffness in the morning. Her neck gets stiffness in the morning after waking up, and she has a mild tenderness in the shoulder, but she doesn't have any form of fever. What is the clinical question here? The doctor finds out is she has an inflammation, she has a pain, she has a swelling. Either it can be an rheumatoid arthritis or polymyalgia rheumatica. To identify the condition, he makes a test which is called as ESR test. So as of design thinking framework, I am here to present and identify the ESR, empathizing the user's symptoms, defining the problem, what is the patient is exactly having, ideate a solution by the diagnosis technique, prototype solution by giving a value of ESR through the diagnosis procedures, and test what is an evaluation of result and what can be the treatment can be given to the patient and how the symptoms has been improved in the patient. This is the pattern of study so that this case study can be defined very easily. So what is ESR? ESR measures the rate at which the RBCs are getting settled down at the bottom, so of a vertical tube. So how much time does this WB or RBC plans to settle down is the matters. It is a non-specific test. It doesn't say about the result. It will help us to diagnose and monitor the inflammatory status. The main purpose of this test is to find out the inflammation in the paining area, where how much the RBC is getting settled down at the bottom and how faster it has been settled down. So it is not a diagnostic procedure alone. It tests the conditions with infection, autoimmune diseases and the cancer. Here in this image you can see a tube-like structure which is filled with the blood. This is how the ESR will be placed. So who find out this ESR? The discovering first note was given by John Hunter and followed by the Edmund Berkeley, and the development is mainly by the Robert Fahers and Alf Westengrad. Now we are following currently the Westengrad method and the Windhoek method, which adopts as a golden standard by International Committee of Standardization in Hematology in 1973, and it was reaffirmed in 2011. Since now we are following this technique, why? Because of its simplicity and still it is relevant to that of our studies of the patient. So what is ESR and how it's done? Actually it is done through the Westengrad method. It's a golden standard. It is a tube-like structure and it's a vertical tube. The vertical tube is anticoagulated and we are adding a anticoagulated blood into the vertical tubing, and the tubing is of almost 200 mm. We are placing the tubing in a place where it adapts to a room temperature, and we will be measuring how much time does the RBC takes to fall out a Rolex formation. The procedure helps by mixing the blood thoroughly, and you want to fill the tube from 0 to the level of the tube, and you want to place it in a vertical track. So it should not be disturbed by anyone. It should not be taken out before the time. Record the clear plasma which is present at the top of the RBC. It's an yellowish fluid which is present at the top of an RBC after 1 hour. This is what a procedure that we will be doing. What this actually the result which is given by this test is of 3 stages. One is aggregation, one is settling, one is packing. Aggregation is a clumping of an RBC into a Rolex formation, and the settling of the Rolex formation at the bottom of the tube at a constant rate, and packing is of RBC is packed at the bottom and settling down where the plasma is at the top, which is an yellowish fluid. So the normal value will be 0 to 30 mm, but since somebody will have an increased amount of ESR, what could be the causes for an increased ESR and decreased ESR? Physiological causes can be in pregnancy, older age, female gender and anemia, and the decreased causes may be a newborn, male and a high altitude or a polycythemia. These are the normal things that physiologically we have. What could be the pathological reasons? Maybe infection, autoimmune disease, inflammation and cancers. And decreased ESR can be a direct problem on the blood cells. That can be sickle cell anemia, spirocytosis, hyperviscosity and congestive heart failure. These can also be a factors. What is the clinical significance given here is you can identify the screening of inflammation, you can identify the rheumatoid arthritis, you can identify the infections. This is what the clinical significance of this tube will describe about us. What could be an advantage and limitations? The advantage is it is a very simple test which is very inexpensive and widely used in all the hospitals and is reliable for monitoring the infectious rate. For example, bone infections and the systemic lupus erythematosus. What could be the limitations is this test alone does not tell you it is a cancer or it is a rheumatoid arthritis. So it is a non-specific and cannot pinpoint a disease. It can be a non-inflammatory factors also, either can be an anemia also. And there can be a technical error, either the tube can get tilted or it can be disturbed. So want to have some technical consideration to do this test. You want to keep the tube in a vertical manner, it should not be tilted, and you want to maintain a proper temperature. You want to have a sampling age. The blood sample should not be more than 4 hours after drawn from the patient, and it should be properly anticoagulated. Without anticoagulated also it can form a Rolex. What could be the quality control standards for this test? Use a standard Western grid tube that is about 2.5 mm to 200 mm in length and should be vertically placed without disruption, and the test should be run within the 2 hours after collection of the blood. So what is the result of these patients that we have shown in the case study is the patient result of ESR is 85 mm per hour after the test. For women above 50 years of age, the normal range is 0 to 30 mm. So what does it indicate? The interpretation is indicating an acute inflammation. This is very much important. The patient is having an acute inflammation that was given as a result. So the treatment according to the patient for acute inflammation of giving an anti-inflammatory drugs will be provided as a therapy for the patient. Thank you for listening.